It's really fascinating to me to see that there are all these different things that continuously move. There's an ever flowing kind of new plethora of drugs and solutions to the what next when it comes to weight management. Bupropion, it's a drug that is actually used to treat major depressive disorder, seasonal affective disorder, and it is also used as an aid for smoking cessation. So, first and foremost, it's an antidepressant drug and it's a treatment of choice for mild to moderate depression. So, for me, first of all, just a disclaimer when I'm talking to you or to anyone about the use of a drug or what that looks like. I'm not a medical professional, but I've worked in this space for 23 years. So, these are conversations that I'm having with my team of medical professionals on a daily basis, with the doctors, with the surgeons, and with patients coming to us every single day. So, firstly, it's actually a drug that's to treat depression first and foremost. It's interesting to see that there's a drug on the market that you might have heard of, and it's an oral medication. It's called Contrave. And Contrave is an oral tablet format medication, doctor prescribed, that's classified under that group of weight loss medications. And this is a drug that combines naltrexone, which is to treat an addictive type behavior, but also has bupropion. So it's a combination of the two drugs together that is seen to be quite effective in management of weight loss and to support reduction in medical related or weight related medical complications. The goal, first and foremost, with anything that we're doing when it comes to weight loss is let's look at how we can prevent chronic diseases from worsening, progressing, but also prevention. We want to make sure that people are going to be safe, healthy, fit, and well as they age. So first of all, absolutely, it's been treating depression and depressive type disorders for a long time. And if people are seeing as a side effect that weight loss is an outcome, that would be probably why this is becoming a trending topic. I think it would be really highly unusual to be prescribing an antidepressant specifically for the intention of weight loss because it's not the intention of this particular drug. I'm just fascinated to see that this is trending and why. I'd love to know more about what are people thinking. Is it the new panacea? Is it the new Duramine or another drug that they're thinking, oh, let's try something else because maybe they've had too many prescriptions for Duramine. You can't live with these kind of medications for long term. They cause sleeplessness, a lot of sometimes anxiety, hair loss. There are side effects when we're looking at all of this group of drugs. And for me personally, what I would like to see happen to any patient coming through our doors is that we're getting them off medications. We're not constantly looking at prescribing new medications, maybe for a short-term treatment plan, but the long term is all about getting people off medications, whether it's their type 2 diabetes medication, high blood pressure, high cholesterol, whatever medications they're currently on to treat medical conditions in association with excess weight. The goal with weight loss is actually to reduce and get them off those drugs. And so bupropion for me in a weight loss environment more commonly would be seen prescribed as Contrave, where bupropion is just one of the components of that drug, and naltrexone is the other component. For some patients looking for a weight loss that might be 10 kilos, 20 kilos, they may not be looking for an intervention, but they might be suitable for a medical weight loss program. Contrave might be one of the drugs that could be offered to that patient. Some patients don't like to self-inject or to have injectable type medication. So there are other drugs on the market that we know are also very highly searched drugs at the moment, whether it's Ozempic or Saxenda or Trulicity or whatever those drugs are. Those are the injectable type medications that are used not just for treatment of type 2 diabetes, but have been trending as a solution to manage and treat weight-related problems as well. So I think the most important thing is, first of all, assessment, diagnosis, and understanding of the why. There's a lot of complex issues that we've got to look at here when we're treating a patient who is overweight. What is their family history, their current medical history? Do they have any medical conditions? Are there contraindications? So this needs to be assessed and managed by a full multidisciplinary team first before making a well-informed decision around a treatment plan. So that looks like seeing a nurse to understand your whole medical status and medical history, seeing a dietitian to understand what's going on there as well, because these are all different pieces of a puzzle that we put together. We're just not looking at an isolated, let's prescribe a drug to treat a patient, because it's not going to work. We're looking at a holistic, multidisciplinary approach to supporting and managing any patient. So that does need to involve, right from that assessment starting point, nurse, dietitian, psychologist, our in-house GP, and possibly a surgeon or physician if there is intervention or procedural type pathways to best treat the patient. This actually makes me really not just concerned, but exceptionally so worried about how we're managing life in general and what are our coping strategies that we have in place to self manage no matter what is thrown our way in life, and looking for a drug as a solution. That's pretty frightening. It's not the way to go. We just don't want to see people think that I've got diabetes, let's take a medication or up the medication. That's okay. It's 100% not okay. And even with things like anxiety and depression, and I see so many patients that fall under this banner of having mental health type concerns where treatment involves a lot of medication. I think we need to look at lifestyle intervention. What are the other things that we can put into place to hopefully reduce the need to rely on medications? And maybe it comes back to looking at our overall approach to lifestyle. What are we doing to ourselves? I'm so blown away by that, to be honest. I hate to see patients who are dependent and reliant on a medication for anything. And if we can better treat, manage, cope, and look at other lifestyle intervention opportunities to build more resilient, healthy population, that would be my intention, because I seriously believe that there's a lot more that we can do. We can be prescribing exercise, Let's come back to looking at what are the other things that we can prescribe as a treatment to solve and help our patient population and our entire community, to help them move away from the reliance and dependency on any drug. This is absolutely something that I love to do, is to help people every single day of my life, but seeing those transformations is the wow factor in my life every day. Seeing the people who do reduce their medications, who are out there training for Gold Coast Marathon and are taking on board all of these new potential opportunities to completely transform their lives. It's the reward for me every single day, and I do love it so much when I see people completely transform their lives. And I guess that's why over 23 years later, it's still a case of a pinch me moment every morning when I wake up, because it's an opportunity to help someone new. So the starting point definitely is to either jump on the WLSA.com.au website, and if you feel more comfortable just sending through an inquiry form, one of the team will get in touch. I'm also super happy to have the conversations. People can get in touch with me, message via any of our social media platforms, or just pick up the phone and give me a call. I love having the conversations with people. I never tire of it. It's one of the most exciting things ever when someone is at that point where they're ready to say, I want to make a change, and I want that change to be for my future, for the rest of my life, for my family, for my children, and for me. At the end of the day, that end goal is, I actually don't want anyone to end up in a nursing home. So how do we actually help people start now and never have a vision of ending up there? You've got to start young, and don't wait until you're at that stage where things are getting worse. So if you're already thinking about, oh my God, I should be able to do this myself, don't put yourself into that bucket. There is help, and we want to help people every day. So first of all, they need to sit in their own seat and focus on themselves and not what celebrities are doing on social media. There's no correlation. They may be people who might want to lose a kilo or two, and they talk in this way that makes it seem realistic to us, but it's actually not. So please don't put yourself in a situation where you're making comparison. My mother used to say comparison is odious. It's one of those terms that I still hear in my head every day, and one of the expressions of my own mum. So just think about yourself, first of all. Self-focus on your goals, your intentions, your future, your health. You're not who you see on social media. And the first thing that you need to do is that self-recognition around what are your concerns? Why do you think you need to look for something more? And that's pretty much the same as over 98% of the population who've failed at some point with diet and exercise, because we know it won't work, but we're led to believe it will work. So please never think you're a failure, and always reach out for help. Just pick up the phone, because we can help you find those solutions, and they're definitely not online through Dr. Googling.